we're going to be showing you how to start an IV on a patient. So first, we're always going to ensure we have everything we need, doing hand hygiene, getting your gloves on, and then I like to prep everything before I start cleaning our patient. So I'm going to open our J-loop, keeping it mostly in the package so it stays clean. Okay. I'm going to go ahead and attach the flush to it so it's one less thing to do. And then I'm going to go ahead and put our water in so the J-loop is primed. Okay. I'm going to open my tape so it's ready to use. And I also like to prep my tegaderm because they get a little sticky once your gloves are on. So I just fold it in half and it's ready. And then we're good to start. Okay, so I always ask my patient which arm they prefer, and Luke said he prefers his right arm. So we're gonna have it on a straight level that's solid. I'm gonna aim to go in his AC, so I want my tourniquet up here. You tie it nice and tight, over, and then almost like a half loop through so that you can easily pop it off. Is that feeling okay? Mm-hmm. Okay, and then we're gonna have Luke squeeze his hand like he does, and it's gonna help your veins pop up. I'm gonna get my catheter ready. This one's looking really good, so I'm just gonna make sure it feels nice and straight, which it does. So I'm going to clean, letting it air dry. And then, do you like me to count or just do it?
Just go on your own.
Okay.
You're good.
So we're gonna open, being aware that it's sharp, always bevel up. I'm gonna hold my index finger up so I can push the catheter in once we find it. You anchor the vein. Then a deep breath, insert. We got our flash.
I'm sorry. You want me to hold these out?
Pop your tourniquet. Get your J-loop. And it's flushing beautifully. So we're gonna hold here. I, at this point, would make sure the safety is on. Clean the arm a little bit so it's easier to stick the tegaderm. Sorry.
You're good.
Make sure the catheter is in the middle of your tegaderm so you can see it. And then at this point, I would take my J-loop, just whatever way it's naturally curving. You take the paper off, and there's usually a little sticker you peel off that has a spot to initial and date. And I like to put it on the outside. Okay, now we're going to show you discontinuing the IV. So I like to grab extra alcohol wipes to help the tegaderm unstick, extra gauze, and then I prep my tape and stick it on my left hand so that I can just hold and tape. So, patient's in a good position. I'm going to start working the tape, and then if it's a little bit of a hairier spot, which might be sensitive, I get my wipe, pull up a corner, and just do a side-to-side motion. Sorry.
You're good.
Try to go a little fast with that so you're not in excruciating. And then again, you pull from the outside.
Oh yeah, you might need to.
Getting it wet if you need to.
It's a good tegaderm.
Pulling towards that center, being mindful that you don't pull out your catheter as you're doing this. Right. Okay, so I have everything gathered up. I'm gonna grab my gauze. Some places I've seen also just use cotton balls, so grab extra of those if that's what they have. I'm gonna go ahead and put my gauze above the catheter with a little pressure, and then on 3 I gently pull out. Holding pressure, I ensure the catheter tip is intact, which it is, safely dispose. At this point, I would also try and clean up the patient's arm if any crusties, this isn't helping, or any blood kind of seeped through. And then you're gonna keep holding pressure and tape down as needed. And that's it.
TI accepted practice and indications for initiating and discontinuing an IV. IVs are used for intravenous fluid and medication administration. The nurse should place the tourniquet approximately 4 to 6 inches above the anticipated site. Adults typically use 20 or 22 gauge catheters. ATI evidence-based practice requires the use of aseptic technique. You can clean the site with chlorhexidine or alcohol. The nurse should monitor for complications such as infiltration or phlebitis. Some key considerations are to select an appropriate vein, trying to avoid the antecubital site, and securing the catheter after placement. Documentation tips include the site, gauge, patency, number of attempts, type of dressing, and the patient's response.